just to get started, we'll skip the overview. This is a presentation about the COVID testing solutions that are currently available to the market, as well as we're going to get into COVID testing emerging, technologies and tests that are becoming available to the market. So with that, I'm going to kick it off with brief introductions. I'm Rob LaHayne, CEO of TouchCare, healthcare concierge company. We're located in New York City. Obviously not a expert on delivering webinars. Otherwise, I would have not muted myself. So apologies for everybody that's been listening in or watching me go through slides with no sound. We work with brokers and their clients all over the country, all 50 states, to deliver healthcare concierge services that are designed to focus on and improve the member experience and ultimately reduce cost. With me today and joining me as our clinical and COVID testing expert is Dr. Lorenzo. Dr. Lorenzo is a board-certified neurologist with over 20 years of healthcare experience. He currently serves as the Chief Medical Officer for MeMD, which is one of the nation's largest providers of virtual care and telemedicine solutions. So to quickly jump back in and introduce everybody to the two companies hosting today. So TouchCare, as I mentioned, we are a healthcare concierge services company focused on improving member experience and reducing healthcare cost by really empowering better consumerism, right? Our goal is to put the consumer back at the center of the healthcare experience by helping them navigate all of the complexities associated with everything from the start, selecting plans, ultimately using your plans throughout the year, and then ultimately making better decisions about your health and hopefully improving healthcare outcomes, but definitely giving you a more knowledgeable, empowered experience as a consumer navigating our complex healthcare system. As you can imagine, COVID-19 has really presented us with challenges that were both unexpected and really have led us into uncharted waters. And throughout, we've done our best as an organization to remain at the forefront of research and resource production for our clients and our brokers to make sure that we're sort of staying ahead of things as best we can, making sure that everybody knows what's available, what's emerging in the market, and how we can help plan members with getting the care they need during a pretty challenging time to do so. We also do offer virtual care services, and it's powered by MeMD, as I mentioned at the outset. So MeMD is our partner for powering both our virtual urgent care and our virtual behavioral health solutions. Through MeMD, we provide our employers and their employees with a national network of clinicians able to treat and triage people via phone or video consult for any of their urgent medical needs. So, reach out to us. We can get you a virtual visit with a licensed professional, licensed clinician in any state that is able to treat, triage, or prescribe you for your urgent care needs. And in addition to that, we partner with MeMD to deliver virtual behavioral health solutions. And through this, we give options to our employees and their family members, our members, to receive expert medical care at a variety of different levels, once again, throughout the country. So breaking down the sort of access barrier for behavioral health care and mental health care, we're able to offer therapy, psychology, psychiatry, and even team therapy solutions in a virtual format for employers to offer to their employees, once again, in all 50 states with guaranteed appointments within 48 hours instead of potentially having to wait for weeks or travel long distances to find the care that folks, in normal times need and really under the current scenario really are in need of. And so with that, I'm going to kick the presentation. I think this is where we picked off before, but I'm going to kick the presentation over to Dr. Lorenzo, and he's going to take us through a presentation on the various testing options currently available and emerging for COVID-19 and really break down the differences for this. I hope you guys find this as educational. That's what it's designed to be, is informational and educational on the different testing options that are available, and then we'll wrap it up with how all of this plays into employers' return to work strategies. So with that, Dr. Lorenzo, I'm gonna pass it over to you.
Well, thank you very much, Rob, and it's a pleasure to be with all of you here today on this webinar. to talk about a very important topic, very timely topic, especially as we start to approach what we're calling the second wave of COVID-19 nationally, and that's the topic of COVID-19 testing. And I'm sure all of you have seen many online articles and TV stories, news stories on testing, and your head's probably spinning with PCR, virus testing, molecular testing, antibody testing, antigen testing. And you're probably saying to yourself, this is just way too confusing. For me, I'll never understand it. But hopefully here in the next few slides, I'll be able to simplify it for you and give you some takeaway points about the importance and the utility of COVID-19 testing. And so let's talk a little bit about the types of testing. And these include what's called PCR. The PCR, as you can see there, is short for polymerase chain reaction. Don't try to remember those long words. PCR testing is basically a virus testing type of test. So what you're testing for is whether the patient or the person currently has and is shedding COVID-19 virus. They're sick with the virus and they're able to infect others. The other type of testing is the serologic or antibody testing. And we'll talk about in detail what this is, but antibodies are what the body produces to fight the COVID-19 virus. And so we'll talk about those in detail. And then we'll talk about a relatively new test called the antigen test. There's one currently approved by the FDA. We'll talk about why that's important. And the lateral flow test is actually one of the types of antibody testing. And so we'll talk about that as well within the purview of serologic testing. So the next slide. Okay. So what about PCR? And what does it mean? What do you use it for? So basically, again, as I mentioned, it's where you're testing the patient for the actual virus. So somebody has a cough or a sore throat or a fever or a runny nose, and the question is, well, do they have your run-of-the-mill upper respiratory infection or cold? Do they have influenza? Do they have sinusitis or bronchitis? Or do they have COVID-19? And the way that we can try to confirm whether or not they have COVID-19 is the PCR test. And how this is done is by taking a sample from the nose or throat, or more recently, even the saliva or the spit, and we can test that sample for the actual virus. And if in fact this test comes back positive, then there are CDC criteria and protocols for home isolation, as well as treating the patient and then judging whether or not they've clinically recovered. And this period is usually 2 weeks. And if the patient has recovered, then they can be released from home quarantine after that 2-week period. So the PCR test is very important for us to be able to confirm, does somebody in fact have a COVID-19 infection? And so what are the advantages of PCR? Well, probably the number one advantage is that it's going to give you an answer. Does this person actually have COVID-19, or do they have some other viral infection that is causing upper respiratory symptoms? And when we can identify these people, we can isolate them, we can treat them, and make sure then that they do not infect others in the workplace especially. And we can track them, do contact tracking to see if there's been any further spread from this particular person. So it's very, very useful for that particular use case. Probably the biggest disadvantage of the PCR test is that it can be negative in the first 3 days after infection. So if you think about it, if you come in contact with somebody with COVID-19 and you're infected by them, you have the virus in you, but you're not going to be immediately symptomatic, and you're not going to be immediately shedding virus. It's going to take about 3 days, maybe a little longer, for you to get symptoms and for you to be shedding virus. So if you're tested in that early period, that first 3 or 4 or 5 days, you may actually get a false negative result, even though you actually have COVID-19 infection. One of the other disadvantages is that in the early PCR tests that were approved by the FDA, it required a long swab to go into your nose all the way to the back of your throat. And anyone who's ever had this test will tell you it's no fun. Just think about that. If you've not had one, sticking a swab into your nose all the way to the back of your throat, it kind of hurts. It does hurt. But some of the more recently approved PCR tests now can use swabs that can just be used in the front of your nose or in your throat, obviously much less uncomfortable. And there are now some tests as well that can use saliva or spit that you will spit into a collection tube. And obviously that's very comfortable and very easy. So the pain issues with the early PCR tests have been, for the most part, alleviated. Also, the testing itself can take anywhere from 3 to 4 to 5 days or longer to get the results back, because the sample that is taken from your nose or from your throat or the saliva sample must then be sent to a specialized lab where the test is run. And the turnaround time for that is 2, 3, 4, 5 days or more. So there is a little bit of a delay in getting an answer with PCR. So what about serologic tests? And we've heard a lot about these, especially in the last few weeks with regard to antibody testing. And what are some of the advantages and disadvantages? What are they useful for? And so let's dive deeper into that. So serologic tests are basically blood tests. There are two major types. One requires a blood draw from a vein, so in your upper arm. There are a few that are approved for a finger stick blood sample, but they both test really for the same things, and that is the antibodies that I mentioned that our body produces in reaction to a COVID-19 infection. So COVID-19 enters the body, we're infected, we get symptoms more than likely, and our body's immune system produces proteins called antibodies, which then attach to the virus and allow the other parts of the immune system to destroy the virus and for us to beat back the infection. And this is true whether you're talking about COVID-19 or influenza or even the common cold. This is how the body fights these viral infections. And so when we test for antibodies, if you are positive for antibodies, you're at least 2 weeks out from the infection, probably longer, and you're probably asymptomatic by now, even if you were symptomatic, let's say 2 weeks ago. As you probably heard on the news as well, there's a large percentage of people who get infected with COVID-19 who have little to no symptoms. They may have a mild sore throat or maybe no symptoms, and they get better. And they never actually know that they've been infected. But 2, 3, 4 weeks later, we can measure their antibodies and see that they had previous infection and now have antibodies to COVID-19. Now, if you knew in fact that you had COVID-19 antibodies, what can you say? So for example, let's say I did this test and I know for sure I have COVID-19 antibodies. The best you can say is that I probably have at least partial protection from a future COVID-19 infection for a period of time, probably 6 to 12 months. That's the best you can say about our antibody testing currently. So just because you have antibodies does not mean that you can go back to your normal life, not social distance, not wear a mask, and think I'm totally protected. Because in fact, even if you have them, it's probably partial protection for a period of time, again, probably a few months. One of the other negatives, if you will, with especially a single positive COVID-19 test is that it only has about a 40 to 70% positive predictive value. So what does that mean? So let's say you get one positive antibody test to COVID-19. You have about a 4 in 10 or a 7 in 10 chance of actually having the antibodies. And you might say to yourself, well, why is that? Well, there are a variety of things that can cause what we call a false positive COVID-19 antibody test. And so just because you get one positive antibody test doesn't mean you have the antibodies. Now, if you got a second antibody test and it was positive, then that positive predictive value jumps to 95 to 99%. So you more than likely do have the antibodies. But remember, I'll repeat it again, even if you have the antibodies, the best we can say right now is that you probably have at least partial protection from a COVID-19 infection in the future for a period of months, probably 6 to 12 months. Move to the next slide. So I think I've outlined a lot of these already, advantages and disadvantages, but I'll just quickly run through them again. So the advantages are that it's a readily available test, inexpensive and cheap. It's using old technology. Most of the antibody testing is very similar to a home pregnancy test, if any of you have ever used one of those. So it's cheap technology, readily available, and can tell you that you possibly have COVID-19 antibodies. And what I will say as well is that over the next few months, weeks to months, there will probably be a home antibody test available. So you can do this at home and test yourself. As far as the disadvantages, again, a single positive test is only 40 to 70% predictive that you actually have the antibodies. Even if you have the antibodies, and I know I'm repeating myself, but I want you to understand this. Even if you have the COVID-19 antibodies, what it means is that you probably have at least partial protection for a period of months to a subsequent COVID-19 infection. And next slide, please. So probably the most exciting new test that is coming out is the rapid antigen test. And there's one currently available as approved by the FDA. And what this is that it is a similar test to what it tests for to the PCR. So what you're looking for is the actual virus, not the antibody. So the antigen test is looking for the COVID-19 virus. So you say, well, we already have PCR to do that. Why do we need antigen test? Well, because the antigen test is a point of care test. So what does that mean? That means it's very similar to a strep throat swab test that many of you may have had in the past, or maybe your children have had, where you go into the urgent care or the pharmacy or your primary care provider. They do a throat swab, and in 10 minutes, you have the answer. Yes or no, do you have strep throat? That's what the COVID-19 antigen test is. You do a throat swab, 10 minutes later, you have an answer. You're not sending the sample to a laboratory and waiting 3, 4, 5, 6, 7 days for the answer. You have an answer right now. And this test is very cheap to produce, can be produced en masse. The one current test that's available is ramping up production. I can tell you that I attend the weekly FDA COVID-19 testing town hall meetings where they discuss all the developments in testing over the last week. And in the next few weeks to a month or two, we're going to have several more of these antigen tests approved. So that's going to be great. And down the road, probably 4 to 6 months, we'll have a home antigen test probably available as well, maybe sooner. So you might say, well, why do we even need PCR once we have the antigen test widely available? Well, there is one negative to the antigen test, and that is it only detects about 85% of the COVID positive patients. So if you had 100 patients who you knew for sure had COVID-19 and you gave them this test, only 85 would be detected. Now, the good news is those 85, that positive test means they have COVID. No more testing needed. But if you get a negative test, you will still need a PCR to confirm, in fact, that you're negative. But because 85 out of the 100 have been detected, you can save ourselves the hassle and the expense and the wait for PCR tests and be able to deal with that particular patient right away, isolate them, treat them, and prevent them from infecting other people. So the antigen test, that there's one available currently, there'll be more here very shortly, is an exciting development. in the realm of COVID-19 testing. One more point there on this slide is talking about antibody tests, and just to remind me to tell you that last month the FDA pulled the approval from 28 antibody tests because of lack of reliability. So the FDA is closely monitoring all the testing, PCR, antibody, antigen tests, to be sure that they perform up to snuff. And if they don't, they'll be pulled, like the 28 antibody tests pulled last month by the FDA. So an important point to note that the FDA is monitoring this situation very closely. By the way, even though 28 were pulled, there are about another 30 or so still approved. So there's plenty of antibody testing out there to be utilized. So next slide, please. So how does testing work into a return to work strategy? Well, it really depends on what your goals are in a return to work strategy. And Me&D yesterday officially launched our return to work offering. You may have seen the press releases in the press yesterday. And when employers look at what type of strategy to utilize as they open up their factories, open up their plants, and people get sick, even without COVID-19, workers get sick every year, right, during cold and flu season. Well, now COVID-19 is in there. And so how do you differentiate these patients? How do you manage them? How do you prevent COVID-19 from running amok in your factory, your business, or your office? And a return to work strategy, an effective one, will require testing, especially the PCR virus testing and later the antigen virus testing, will be very important to deal with those people who come into work and say, hey, I'm sick today, or I've got a fever. And so it's going to be a very important part of the strategy. And so knowing who does have and who does not have COVID-19, as we move into the cold and flu season, move into the second wave of COVID-19 infections, is going to be a critical part of employees being comfortable, employers being comfortable, bringing their workers back, keeping their factories open, keeping their plants open, and doing so in a safe and an efficient manner, and preventing the spread of COVID-19 to help our economy keep moving forward, keep our people employed, and keep everybody comfortable. Next slide, please. I think the slides are frozen, or we move on to the next slide. Okay, I'll turn it back over to Rob.
Great. Yeah, and Nick, thanks for that. Super helpful. And really, as I think about this, on even on your last slide, I think about how this impacts us as an employer, not as a provider, but as an employer. And if I put my employer hat on, really what I'm worried about as we ask our employees back to the office, and as we start to open up our doors again, is really how do we create a workspace that my employees feel safe to come back to, and how do I ensure that I cover all their medical needs to make it safe for folks to return to work and to feel like we're prioritizing their safety as they do return to work. And to me, the big key that you hit on there is really the access and the early detection as a preventative measure for keeping the office safe, right? And all of this testing really allows us to ensure that employees who are coming into the office are medically cleared or medically being handled, right? Or at least low risk for spreading the virus when they do come into work. And to your point, right, folks are gonna get sick, especially as we head into the fall and the winter again. And we are going to need effective ways to test for COVID or rule out COVID before having them come back into work. And we're going to need effective ways of providing medical oversight and doing so quickly and virtually that allows us to rapidly respond to symptoms and testing with the proper clinical guidance and next steps for each employee, whether that be, hey, you're clear, or, quarantine and retest or things like that. So it all kind of plays into that bigger picture of, number one priority for me, how do I keep my employees safe, and how do I create an environment that gives them access to the right tools so that everything, actually is safe and there's proper medical oversight for return to work. And so TouchCare, we've partnered with the MeMD team to bring to market solutions that combine our expert healthcare navigation and their expert clinical support and return to work services, and then also access for testing for employees. And so we call our solution TouchCare Shield. And I think it's also important to note that this is something that is evolving every day, right? So initially we're helping out with the virtual medical oversight and the healthcare navigation services. Then we add in testing. Now we're starting to evolve into a service that can eventually, hopefully, deliver some of those at-home COVID tests, read them, provide the medical oversight, provide next steps, and write orders for PCR tests, assist with things like filing for disability and remaining compliant under the Family First Coronavirus Response Act. And for more information on all of this, you can reach out to us and our team at TouchCare via our website or through sales@touchcare.com, and we'll be happy to get in touch and kind of walk you through our solutions. And with that, we'll wrap up the formal presentation portion of the webinar here. Once again, really apologize for the technical difficulties that we had there at the beginning. We did have just a couple of questions that came through, mostly for Dr. Lorenzo. So I can read a couple of these off and have Dr. Lorenzo answer if you're still with us there and we're not experiencing technical difficulties anymore. But really, as an employer, the first question here is, as an employer returning back to work now and as employers to come back to work or thinking about the return to work strategy, which of these tests should we be prioritizing?
Well, thanks for that question. And I think I kind of touched on this already. So it depends on what you're trying to address. I think both categories of tests, whether we're talking about the PCR virus test or the antibody test, have their utility. The PCR virus test is going to be very helpful to be able to determine when you have a sick patient and whether they have COVID-19 or not, because the isolation and treatment and repercussions, contact tracing is all going to be dependent on whether or not they actually have COVID-19. So that's what the PCR virus test is critical for. As far as the antibody test is concerned, it gives an employer an idea, and employees too, who may have at least some partial protection from COVID-19 infection moving forward for the next 6 to 12 months. That can be very helpful, again, both for the employer and for the employee, knowing that at least they have some protection. Not to say they should not be still cautious with social distancing and wearing masks and so on, but knowing that you have some partial protection can be a comfort both for the employer and the employee. So for keeping or reopening a business or keeping it going, especially as we move into the fall and winter months, the testing is going to be a very important part of being able to do this efficiently and safely for everybody involved. So again, both categories of tests have their usefulness.
Thank you. And yeah, this one just came through more on the administrative side, but Nick, if you wouldn't mind, or Dr. Lorenzo, if you wouldn't mind expanding on this one a little bit. So related to the Family First Coronavirus Response Act, what are we doing to support that? What are you doing to support that?
Sure. And so, at MeMD, we actually were faced with some of these relatively new regulatory and legal questions and requirements pertaining to COVID-19 in the workplace. And so we have done a significant amount of research into our own back to work, return to work offering that can give advice on such issues. We have dealt with them in the last 13 weeks. Again, all of these are new issues specific to COVID-19. So we are prepared, as I'm sure TouchCare is as well, to address these issues. And it wouldn't surprise anybody to know that, especially as we get to the return to work situation, that there are a lot of complex issues legal and regulatory. It's not just about testing, not just about virtual care telehealth. It's also about what do we do as far as HIPAA and privacy? What do we do about disability? What do we do about these specific forms that might need to be filled out? Lots of layers to this onion, if you will. And both TouchCare and Me&D are prepared to be able to handle such issues.
All right, I've got a couple more here, and I think you touched on this one already at the end, but the question is, when do you think that the home test and the antigen test will be more readily available for employers to use for testing, rather than having to send them somewhere or having to have them come in?
So as far as home testing goes, right now, home testing is approved for several types of the PCR virus test. So they're already out there. There are coming next will be the home antibody test, probably in the next few weeks. As far as the antigen test goes, there's only actually one approved antigen test right now. There'll be more coming here in the next few weeks, as I mentioned. Those will still be not in the home. I think as far as a home antigen test, we're probably looking at several months down the road. But remember, the antigen test can be done very easily at the point of care. So again, think of getting a strep swab throat test at your pharmacy, at your primary care, at your urgent care. Very easy to do. It's read right there. You have your answer in 10 minutes. So the antigen test, even not being available in the home, once it's widely available, which it will be very shortly, will be very useful. So again, home testing right now for PCR is available. Antibodies are going to be next, probably the next few weeks. And then home antigen testing probably a few months down the road.
And Dr. Lorenzo, one of the questions that came through as a follow-up to that is the antigen test, is the antigen test the same as the Abbott POC test?
No, there is only, so the Abbott POC test is actually a PCR test. But the reason it's called a point of care test, the Abbott test, is because the machine is relatively small. So you can have it at the point of care, but it's still a sophisticated machine. So the vast majority of PCRs are still done in specialized labs. So the samples are collected and then sent to these specialized labs. The Abbott POC device is still a very specialized device, but it's relatively small. And so it is available in many hospitals and doctors' offices. It's not just used, by the way, for COVID-19. It's used for other tests as well. So that's a PCR test as far as the Abbott POC.
Okay, great. And I got two more here. This first one is actually specific to TouchCare. So how does TouchCare help in finding a facility for COVID and beyond? So actually, that's an interesting question, because these times have presented an interesting challenge for us as an organization, as healthcare facilities have largely shut down elective procedures and shut down non-COVID related procedures. And so we've had an interesting challenge there in helping our members go through pretty thorough processes of finding facilities that are willing to take patients and willing to do procedures, even extended beyond medical and into dental and dental procedures. We've had our fair share of those types of requests, and really there's no magic bullet for that. I would say it's a lot of effort on our team, doing the research, building the sort of database on our end, and then making the proper phone calls and things that we can do to help the member out with getting care when needed. There's another question on here that is a little bit out of the employer realm, but specific to, and this is the last one, specific to sports leagues. And actually, this is an interesting one for us, because it's something that we're working on right now with a sports league. But how do we, to summarize it, how do we support return to play for sports leagues and little leagues and things like that. And so we actually are right now working out a solution to see if the TouchCare Shield program will work for a pretty large little league organization that is looking to do just that. And so I would say, the process and the protocol is relatively similar, with widespread testing being a big piece of the focus for both the parents and the children, and obviously the coaches and everybody else involved. We'd be happy to have, I guess, a separate conversation specifically related to that. But I'll leave it at that for now. But we have, and the trick there too is related to testing children. There has to be parental guidance and a waiver that's signed off on. So it adds a little bit of an extra administrative lift, but it is something that we have been asked and are working on with a couple of different clients right now, actually. And it looks like that actually wraps up the questions that we did receive. And so once again, I want to thank everybody for joining us today, and thank Dr. Lorenzo for the excellent information, really helpful. Appreciate you making yourself available and taking us through the different intricacies of the testing options that are available, and ultimately helping us wrap that up with how it all plays into return to work. I want to apologize again to everybody for my technical difficulties there in the beginning, and remind everybody, because I was probably muted when I said it originally, but this will be recorded and sent out to everyone as a follow-up. So it will be made available as a follow-up. So once again, thanks everybody for joining us today, and have a great weekend.
It's been a pleasure. Thank you.